So we're going to be talking about neurofibromatosis, and there's two types, and today we're just going to be talking about neurofibromatosis type 1, NF1. It's actually strange that they're both called neurofibromatosis because they don't have anything to do with each other. One is on chromosome 17, which is NF1, and the other is on chromosome number 22. So they're completely different disorders on different chromosomes even. The reason it comes to ophthalmology is because it's associated with a tumor, the optic nerve glioma, in childhood, and that usually comes to us as painless progressive loss of vision, an RAPD, and a pale nerve or swollen nerve. Although because it can be retrobulbar, it can be a normal nerve. The optic nerve glioma also is a bit misleading because it can be anywhere in the optic pathway. So I prefer the term optic pathway glioma, which means it could be in one optic nerve, both optic nerves, the optic chiasm, or in the optic tract. The other features that define NF type 1 include the presence of those neurofibromas, and you need two of those. And if one of them is the diagnostic one, the plexiform neurofibroma, which in the lid causes this S-shaped deformity in the lid, then you don't need two, you only need one. That's almost pathognomonic of NF type 1. You can have abnormalities in the sphenoid bone. Usually the sphenoid bone is just missing, and that can cause pulsatile proptosis. And on the skin, we're going to be looking for cafe au lait spots, which means it looks like coffee with milk. So they're flat brown macules, and it depends whether you're pre or post pubertal on the number of cafe au lait spots that you have. So you have to have greater than 5, which is 6 or more, and they have to be greater than 5 millimeters in size when you're pre-pubertal. But after you're post-pubertal, so after age, say 15, the size has to be 15. So it's pre and post-pubertal, different size characteristics and number of cafe au lait spots. And of course, if you have a first degree relative with NF1, that's a diagnostic criteria. And because we have the gene test now, you can just test the person for NF type 1, the gene. So you need to know a little bit about neurofibromatosis type 1. It comes to us as optic pathway glioma in childhood. There are defining features that we're going to be looking for: sphenoid wing aplasia, plexiform neurofibroma, the cafe au lait spots, pre and post pubertal, first degree relatives, and tests for the gene.